All right, so we're gonna go ahead and jump in here and show you this patient. You can see she has a very severe underbite. That lower jaw is very pronounced and that upper jaw is very retrusive. So that's leading to this severe underbite. As well as the underbite, she has a lot of crowding, a very narrow upper arch, and just kind of some asymmetric jaws as well. You can see her lower jaw is quite a bit shifted to the left. So when this patient came in, the parents were wondering if there's any way we could treat this without surgery. And this is one of the rare cases where I said there's really no good way to treat this patient without jaw surgery. Most of the time it is an option, but we can get a good result with just braces if surgery isn't an option. This is one of those rare cases where I said there's no way that we can get a good result without doing jaw surgery in this case, and it's really the only way that I would choose to treat it. So normally when treating underbites, we have a couple options. There are elastics, extractions, and jaw surgery. So elastics, how they work is when you're in braces, you hook the rubber band up to the top molars, as it's going to show here in this animation. It's pulled forward to the lower anterior teeth or the front teeth, and then you can slowly over time pull the teeth back on the bottom and the top teeth forward. In the patient that we discussed earlier, this was not going to be an option. There is a limit on how far you can move teeth. The teeth sit within bone, and you can't pull the teeth beyond where that bone is. And so elastics work in really the mild to moderate underbite. And in our patient, you can see these teeth just cannot move that far. There's not bone sitting back here for these teeth to move into. There's not bone sitting up here. So moving the teeth within the bone wasn't an option. We had to move the actual jaw bones. And then another option for certain patients is extraction. So by extracting certain premolars and then using braces, we can direct the teeth into these extraction spaces. This is a good option for more of your moderate underbites, cases where we can move the teeth within the bone and still achieve a good result. But like I said, this patient, extractions alone weren't going to be enough. So this patient, we actually did extract upper bicuspids and lower bicuspids, but it was more to resolve the crowding, not so much to solve the underbite. So we did extract 2 bicuspids on the bottom, 2 on the top as well. That was purely just to align the teeth, to level out the arches, to resolve the crowding. But the underbite was not fixed with just those extractions. And basically she ended up with straight teeth, but with still this pronounced underbite at that point. So the process for braces and jaw surgery goes like this. We had her get those teeth extracted, like I mentioned. We did braces top and bottom. We got all the teeth straightened out. We got everything aligned. We got leveled out. And that took us about a year, a little over a year for that process. And once they're at that point, we can refer her to an oral surgeon for the actual jaw surgery. So this video will demonstrate how that works. You can see in this animation that this patient's teeth are already straightened, and that is when the patient is ready for jaw surgery. And so the surgery that this patient received was, it's called a mandibular setback. That's where the lower jaw is set back and the upper jaw is brought forward. So you can see in the process here, the teeth are aligned first. Then this is what the surgery looks like. The lower jaw is set back, and that upper jaw is brought forward. And so rather than moving the teeth within the bone, you're actually moving the bones into where the teeth fit together. After those bones are moved, these titanium plates are placed, and these stay in for life. These help to set the jaw into position and help it heal into that position. So it gives us options for correcting severe bite problems that aren't available with braces alone. So this is the patient when she started. You can again see the jaw is to the left. That is something that can be fixed during the jaw surgery process. That upper jaw is set really far back. The lower jaw is set really far forward, as well as that upper jaw is very narrow. So all those things can be fixed during the surgery process. So this is the patient after braces, after jaw surgery. You can see how profound of an effect this had. Like I mentioned, she had 4 teeth removed, and that upper jaw was brought forward, the lower jaw was set back, and then that lower jaw was reset so it was more symmetric to her face and more in line as well. Also, the upper jaw was widened out during the surgical process to give her more of that wide smile. And so the before and afters on this one are really striking. You can see just how much her lower chin was recentered to her face. You can see how much correction was made with that underbite, where before those lower teeth were probably 14 millimeters forward. Now they're exactly where we want them, in an ideal position. Everything's straightened. We were able to get good expansion on that upper arch. And then facially, you can see how much of a change this had to the patient's jawline and profile. That upper jaw was brought forward, which really helped to bring up that upper lip. That lower jaw was set back, which helped to balance her profile, which gave this really shocking, stunning result. And then just the change in the teeth, you can see everything was aligned well. We did have some extractions done to help bring these teeth into the arch form, to help keep everything aligned. And here's a before and after of just the profile shots. So you can see just how big a change this made to her jawline and her profile. So we get a lot of questions in the YouTube comments. If I get braces, will it change my jawline? If I get braces, will my lower jaw come forward or down or back? Will this change my jawline if I have extractions done? I always say, if you get just braces, you will move the teeth and maybe the lips a little bit. If you want to change the jawline, that's really where jaw surgery is needed, and that's the only way to properly do it. You can get minor changes maybe to the bite and maybe the height of the bite, but you can't get a dramatic change to the jawline. So if that is desired, surgery is recommended in that case. So jaw surgery is something that we don't do a lot of in our office. It is something that's fairly expensive. Usually it requires some major medical insurance. Also, it is not a small procedure. Usually it's, a fairly intensive surgery, several weeks of recovery. But like I said, in this patient's case, this was really the only way to do it. So it is something that we recommend for certain patients. Only a handful do it each year. But cases like this, you can see just how dramatic it can be. So if you have any questions about jaw surgery and braces, feel free to ask them in the comments section below. We'll do our best to answer. If you're new to the channel, make sure to subscribe and tap that bell for more brace-related content. And if you found this video helpful, please give it a like. It helps our channel. And thank you so much for watching, and we'll talk to you soon.